Welcome. I'm Dr. Cary.
And I'm Dr. Jonathan.
And welcome to
Coffee Talk. On today's third episode of Coffee Talk, we're going to take a slightly different approach than we did in our first two. And we're going to tackle a new format, which is one non-clinical question, because after all, life isn't just dentistry. And then we'll do one dental-related topic. So we hope you've watched the first two episodes, in which we did 21 questions. You can learn about Dr. Cary, Dr. Dad, I say, and myself. But today we'll go a little bit different. So how do you want to start out today, Dad?
Well, I think a nice topic would be your top 3 concerts you've attended.
Ooh.
Live concerts.
Okay, I really like this topic because we are both avid music buffs, music fans. We like similar and some different stuff.
Mm-hmm.
So I'm interested to hear. I actually do not know your answers.
No, you don't.
No.
Because I've been formulating them in my mind, and I wish I could limit it to 3, but I will.
All right, very good. Okay, so I guess, what, do you want me to go first?
You go first.
Okay, all right. Let's start with number 3. I'm going to go with Hozier. Hozier, right, okay. So Hozier is a newer artist. Well, I'm going third to first.
Of course.
Hozier
yes.
is a newer artist. He's been in the last few years. He's Irish, but it was a beautiful performance. It was just like listening to, it was so good. It was like listening to the album, but just right in front of you. It was just fantastic.
You want to hear my number 3?
Sure, you go with your number 3
Okay.
next.
Number 3. This is tough. I will have to say, this is a tough one because I already know my number 2 and number 1. All right, I'm going to go with a combined concert of Chicago and Earth, Wind, and Fire.
Oh, was I at that one?
That was in Camden.
Yes, that was fun. That was really fun.
I was dancing in the aisles.
I had a new appreciation for Earth, Wind, and Fire after seeing that.
They're great. They're great.
And also it made me really sad that all the really good Chicago stuff that was really more rock and roll early on became so lame. 80s 80s rock.
Their early albums were really good.
Yeah, 25 or 624 like
Right.
that. I remember when you introduced me to that song. I was
Yes.
like 12 years old when you showed me that song. I distinctly remember like, oh, what is this? This is amazing.
And I have seen Chicago several times, but that combined concert was just you couldn't stop moving in
that
your
was
chair.
amazing.
It was great concert.
Let's see. So number 2 for me, I'm gonna go with one you do know, Neil Young.
Oh,
So Neil Young performed, and the band that he was with was Willie Nelson's son's band. Lucas Nelson, Promise of the Real. That's the name of their band. The reason, I love Neil Young. Obviously, I love Neil Young because you introduced me to Neil Young. But the fact that he was 70 at the time, I think, and he was
good age.
He was rocking. He was absolutely rocking, and it was just a combination of like this guy's been doing it for a long time, and he was with a very youthful, fun, energetic band. And as he says, it's better to burn out than to fade away. So he was burning out.
That's a good way to phase out. For sure.
Definitely. It was an awesome concert.
Number 2. A couple of summers ago, James Taylor opening up for the Eagles.
Oh wow! Okay.
At Citizens Bank Park. Again, a rocking concert by the Eagles. I won't list them all, but what a great concert! And James Taylor opened it up with his top hits, and that was just reminiscing 70s and a little bit of 80s too.
Yeah,
but,
James Taylor is so great.
Yeah, Eagles, just a fantastic band.
Oh yeah, them too. Oh my gosh. Yeah, these are like You're like almost cheating. You're putting 2 bands per concert.
Yeah, that's good. Well, you said it was concert. So.
All right, fair enough. Fair
Yes.
enough. All right. Okay, so number 1 for me, I want you to guess actually.
Ooh, it has to be Maroon something.
No, I don't like Maroon 5.
Oh, not Pearl.
Not Pearl
It's
Jam.
P.
No, I'll help you out. It was the concert where I ended up first row. Red
Hot Peppers.
Red Hot Chili Peppers.
Red Hot.
Red Hot Chili Peppers, yes.
Uh-huh.
Yeah, so Red Hot Chili Peppers, this is a concert when I was in college. I think it was my freshman year. I had seen them the night before, and my friend Ian had an extra ticket for me. I only come to find out years later, he didn't have a ticket for me. The friend who had the extra ticket never got to get to the concert on time.
Oh.
So I made my way all the way down there. I ended up getting a ticket from a random kid who thought I looked normal, and I decided to
Little did he know.
I decided to go with him and his college buddies. I think we were second row from the band.
Wow.
And I caught a drumstick from the drummer Chad Smith.
Oh my.
And I mean, it was completely epic, and it was like right in their heyday, and it was a sweet spot in my life. So that's number 1 for me, Chili Peppers.
Number 1 for me. Oops. Well, I guess you'd all expect me to say Paul McCartney, and I have seen him 4 times. But I think what left an indelible impression on me was the very first concert that I went to in 1966 when I was living in Rhode Island as a youngster and teenager. And again, that concert had several bands that I grew to follow. And it was opened up by Sam and Dave.
What did they perform?
They sang a song called I'm a Soul Man.
Oh, yeah, sure.
And
Yeah.
then they were followed by a group, a one-hit wonder called Strawberry Alarm Clock, and they performed the song called Incense and Peppermint.
The only reason I know that song is because it was in Austin Powers 1.
They had a one hit, and it was a wonder. It was a good one. They were followed by Buffalo Springfield, and I became a big follower of Buffalo Springfield. At the time, they were playing their song,
As good as, wait, what is it?
For What It's Worth.
For What It's Worth.
For What It's Worth,
yeah.
right. And then the main event, the Beach Boys.
Oh, there
And-
were 4 bands.
Right, and the Beach Boys had just come out with Good Vibrations. And that's still one of my top favorite songs of all time. Good Vibrations.
So I named 3 bands.
Yeah, and I
you
named 10. But 3
You
concerts.
named 8 bands with 3 concerts.
Well, I didn't. I could.
you
go
made
on.
you made it count.
I didn't make. There was a concert with Billy Joel and
Elton John.
And Elton John.
That's classic,
that.
yeah.
So there are so many. I've been very fortunate to have been to a few concerts.
I'm very fortunate that you
Yeah.
introduced me to so much good music too.
Well, you know what? Music is very important in life. It enhances your right side of your brain, and it all it does is give you pleasant feelings and good feelings.
Yeah.
And so music is very important. Growing up in our household, music was playing all the time.
Oh yeah, absolutely. So, okay, well, I hope you guys learned a little bit about us, you got a little insight. You want to take it dental?
Yes, so now we're going to talk clinical dentistry, which means...
Don't turn off the video. Keep watching.
You know, this is interesting because we're going to talk about smiles. Smiles.
What makes the perfect smile?
What constitutes the elements in making the most beautiful smile that you can have? And there are many things that most people don't think about that we as dentists look at critically and analytically to improve somebody's smile. It's not just whiter teeth.
Right, I was going to say, that's the first thing. Everyone sort of assumes how white your teeth is that's the instant fix to everything. But really, that's only a small portion of the puzzle. And a small one at that.
Right, we call that the smile zone. And the smile zone consists of the lips, because that's the border, the gums, because that's the inner border, the teeth, and a lot depends on
And the skull.
and your whole facial appearance.
You got to make sure the oral surgeons are happy here. The skeletal component is huge. So orthodontists and oral surgeons, we are not ignoring you.
No, not in the least. So where should we start? Let's start with the outside and work our way in.
Well, one thing I want to say is symmetry is found in nature. Whether you're looking at a leaf, the way a tree develops, roots, in so many different ways how water flows. We like to find symmetry in nature, and so what we find attractive in the human smile is mirrored in that nature. So we like symmetry. We like when the two front teeth mimic each other. We like when there's a midline. We like when the line between your eyes and the middle between your two front teeth is in the same pathway. A facial midline and a smile midline. So symmetry for me is one of the first things that I look at.
And another aspect of symmetry is the right side balance mirrors the left side. That's one thing. But we also look at symmetry in a horizontal manner because the line that connects your eyes, or the interpupillary line, must be parallel to the plane of your teeth. In other words, you don't want your teeth like this.
It's called a cant.
You want it like this, so that it's parallel to the interpupillary line. So we look at that.
You have to look at things in a plane. So there's the vertical and the horizontal axis, and
Right.
there's the other one too.
There's the other plane that
Transverse plane?
the tragus line, which is the corner of your nose to the ear, inside of your ear. That's a line, and your bite is parallel. When you go from front to back, it's parallel to that line. So when we're fabricating dentures, we have a device that we can check your horizontal, check your vertical, and check your tragus line. So again, mechanics are a big part of dentistry. We need to know mechanics so we can constitute a smile that's symmetrical and mechanically appears right.
So I always like to say, I like to begin with the end in mind, which is one of those 7 habits of highly successful people. So when it comes to designing a smile or looking at someone who's unhappy with their smile, I always like to ask, well, what is your goal? What are you trying to achieve here? Because if it's simply brighter teeth, well, then it can be bleaching if that's a possible solution. But sometimes patients don't have the vocabulary to say, oh, it's the gingival zenith that I'm concerned about. No one's going to say that that's what they're concerned about. They might say, my gums are showing too much, or I don't like how this tooth is rotated. So then it's up to us to say, okay, well, maybe it's because there's some crowding. Maybe there are some rotations. Maybe we can see that your midline is shifted a certain amount. Maybe we can see that your axes are off parallel and they're canted. Actually, there's a very famous example of an actor.
I wonder who that is.
Yes, it's always referenced, an actor in Hollywood, and there's many of them actually, that has a significant midline discrepancy, and
Right.
that is
Tom Cruise.
Tom Cruise. So we'll put up a picture of Tom Cruise's face, where his midline of his teeth, which is usually supposed to be right down the middle of your eyes, is off quite a bit. Now, the interesting thing is that the studies have shown that I believe it's up to either 4 or 5 millimeters.
Correct. Yes. Yeah.
And that the average person cannot tell.
Right.
So no one's looking at Tom Cruise and say, oh, he's disfigured, because
Except we dentists.
the dentist, and even the dentist, can only tell about 2 to 3 millimeters.
Right.
Same thing with orthodontists. It's like it's not, we can't tell if it's dead center. We do have some leeway. So don't worry, don't go measure yourself in the mirror and say, I'm 4 millimeters off. Don't worry, you're going to be good. No one's going to tell anyone.
You can still be a star.
So why don't you talk about gums? How do the gums play a factor in here?
So, outside of the gums are the lips, of course, and people can have a high lip line, a low lip line when they smile. Do they show a lot of teeth? Do they show gum tissue when they're smiling broadly? So a lot of that is the muscle, the orbicularis, if I remember
Very good.
correctly.
Yes,
Thank
very
you.
good.
The lip muscle. So it's circular, obviously, and for some people, like myself, I don't have a high lip line when I smile. You don't see a lot of my teeth.
You can't see any of your gums.
Right, and so you can't see any gums. But
Right.
other people have a high lip line, and they show a significant band of gum tissue. Now, that could be attributable to skeletal. It could be attributable
A larger maxilla.
Maxilla is the upper
bone
jaw.
right here could be more pronounced, longer.
It could be that their teeth are short, and people have short teeth.
That can be also from the teeth wearing down or naturally shorter,
Right.
or the gums are covering the tooth that makes it look shorter. That's called altered passive eruption. Sorry, go ahead. I'm just trying to explain.
Yes, and
Muscle pull is another one. So
Correct,
how much the muscles of the mouth and the smile, how much they pull. Sometimes fixing a gummy smile, for example, is just as simple as reducing how much those muscles can pull. And sometimes you can fix that with something like Botox.
so if you pull your lip up, you'll see the muscle that connects the gum tissue to the inside of your lip. That's called a frenum. And you have different frena on the upper arch, the maxilla, and the mandibular, the lower arch. Those are muscles that hold your lips and your cheeks to the skull, okay? So that has a bearing on your smile as well.
Right. Okay, so we talked about symmetry, we talked about the different accesses, we talked about midlines, we talked about muscle pull and gum display, we talked a little bit about shade, and you want to touch on rotations of the teeth, crowding, stuff like that?
So another aspect of the smile zone is how the teeth are lined up. Are they aligned along a nice U-shaped curve, or what we call an arch? And the alignment is contingent upon two things. The size or width of the teeth and the size or length of the arch from here to here. If the teeth are big and the arch length is small, you're going to have crowding.
Vice versa, and then on the
And
contrary,
conversely, if the arch length is big and the tooth width is small, you're going to have spaces between your teeth.
spaces are usually easier to correct than crowding, but both are,
So these are
Very
orthodontic considerations that we have to keep in mind, because sometimes to improve somebody's smile, it necessitates doing orthodontic work before doing any kind of restorative or cosmetic work.
So tell me, what does it mean to have an overbite or an overjet? Because a lot of times people say, oh, I have a bad overbite. Well, overbite is actually, we want an overbite.
Yes, normal overbite overjet relationship is your upper teeth overlap your lower front teeth by about 1 millimeter.
This
Like
is
that.
considered overbite. Okay, what would be overjet?
Overjet, so overbite is a vertical relationship between the upper and the lower front teeth, and overjet is commonly mistaken.
Instead of this,
It's also called what people would say buck teeth, where the upper teeth are far forward, overlapping the lower teeth. They're not touching, there's a space between the upper and the lower teeth.
so there can be a regular overbite, which is normal and healthy. Okay, we like that. You could be edge to edge, as we call it. You could have too much overbite, or you could have overjet, and you could have the opposite. You could have too little, where people their jaw is sticking out like that, almost like a bulldog. So yeah, these are all factors that play into what makes a smile attractive. Of course, it's all subjective, right? So I'm not saying that anyone that has spacing or rotations or crowding, it's not an attractive smile, because really, your smile is about the warmth that you exude. So just if you don't have a perfect dental smile, that doesn't mean it's not a beautiful smile. Smile starts here. So don't feel bad if you feel like we're critiquing a smile. That's not the case. It's just what we focus on. It's our job.
Right.
And we're here to help however you want. I saw a patient about 2 months ago. I think she was about 9 years old, and she had a pretty substantial gap or diastema between her two front teeth. And I said to the mom, I said, has she seen an orthodontist yet? This gap's gonna probably, it's gonna be remaining for several years. And the 9-year-old goes, I like my gap. I love my gap. And then I thought, that's so great. I said, good. You love yourself, and that's how it is. And then I laughed because then the mom smiled, and she had a gap too. Uh-huh. So I realized, you know what? That's just good parenting more than anything. Right. You gotta love yourself. So,
right.
And if there's something you want tweaked, you can talk to us, and you can maybe from this video you have some a greater vocabulary in terms of dental specific terminology that might help you focus on what you want to point out to us. Maybe it's you showed too much gums, or the gum height of the teeth is unlevel. Maybe your smile is too broad and you're showing more than you want. Maybe you have crowding. Maybe you have spacing. Maybe you have midline discrepancy. All these things are things you can certainly reference, and I'm sure we missed some things.
Well, one thing that pops into my head
let's talk about
is when we talked about symmetry, the gum line. So we as dentists know that the gum line above your two front teeth, your central incisors, is one height. The gum line of the lateral incisors is a little bit lower, and then the canine gum height or margin, the gum margin, is at the same height as the central incisor. So it starts high, goes low, and goes back high again. That's normal symmetry. Sometimes the gum tissue is too low and needs to be recontoured so it's symmetrical with the other. Again, these are the things that we are looking at, and they're details, but it completes the smile.
And that, what you had mentioned, and I'll edit it up a little bit here, but the way you describe the smile line, if you have a low smile line, like you and I, where you can't really see our gums, that's not really a factor for many people.
Right.
We're not going to spend time really focusing on your gingival height if it doesn't even show.
Right.
On the contrary, we want to focus on what matters to you and what matters to your unique smile.
Right.
So we talked about a lot of different things.
Mm-hmm.
Hopefully it didn't get ultra complicated, and we made it accessible. But
is there going to be a quiz?
Only yes. Answers below. Okay. The question is that you have to answer is, what was your favorite concert that you've ever attended? We would love to know. Of course, feel free to share the video. I would especially love ideas for other topics you may want us to talk about, whether it's questions about dentistry or non-clinical questions about life. What was it like growing up in a dental household? Whatever, we can cover it. So thanks for tuning in to Coffee Talk, and we'll see you in episode 4. Cheers.